Mr. Bøger, what is ADMA?
ADMA is the abbreviation for asymmetric dimethylarginine. That is a substance very similar to L-arginine. It is present in all our blood in very low amounts, and ADMA blocks the formation of nitric oxide in the arteries.
How does ADMA act in the human body?
In the human body, nitric oxide is a very important molecule. Nitric oxide is formed from L-arginine. When people have a high level of ADMA, this ADMA will prevent the formation of nitric oxide from L-arginine. And that means that anybody who has a high ADMA level has a low nitric oxide formation in the arteries.
Okay. How important is nitric oxide in the blood?
Nitric oxide is formed in the arterial wall. It is a very important molecule that was discovered in 1981. It is now regarded as the one most important mediator that maintains the health of the arterial system. So, studies clearly show that people who have low amounts of nitric oxide, or people whose arteries cannot form any nitric oxide anymore, have a very high risk of developing cardiovascular disease, atherosclerosis, heart attack, and death.
Is insufficient nitric oxide important in the development of diseases other than atherosclerosis, heart attack?
Yes, nitric oxide is very important in the cardiovascular system to maintain blood flow. But nitric oxide is also formed in other cells and other organs of the body. For example, in the nervous cells, there's a lot of nitric oxide, and this nitric oxide contributes to the depression of pain. It helps in memory formation, and consequently, people, for example, with Alzheimer's disease have a lack of nitric oxide. Lack of nitric oxide is involved in degenerative diseases in the brain, like Parkinson's disease and others. And also in other organs, like in the lungs, nitric oxide plays a very important role. We know now that, for example, nitric oxide soothes the symptoms of asthma. And in the belly, in the abdomen, nitric oxide is an important molecule that reduces the inflammation of the guts and the intestine. So when we influence nitric oxide by whatever means, we can actually influence a lot of various diseases. And that explains why people, for example, who take arginine supplements, report of so many different diseases, the symptoms of which get better during this supplementation.
Can we reduce the value of ADMA if we eat food with antioxidants?
That is a difficult question because the answer is not very well known. We know that chronic inflammation and oxidant situations can increase ADMA. So we can hypothesize that antioxidants may lower ADMA, but there is no proof for that.
Okay. From the laboratory test, we can see the result. We obtain a value of L-arginine ADMA ratio. Optimal range is over 160. Do we need to take supplement of L-arginine if L-arginine ADMA value is, for example, 130?
That is a very good question, and there is a quick and a long answer to it. The quick answer is the optimal range of arginine-ADMA ratio is over 160. So everybody below that should get on an arginine supplement. The long answer is that the risk of heart disease depends on the individual person, the blood pressure, the cholesterol level, the family history of heart disease, and so on. So my recommendation normally is that people who have a high risk and have a low arginine-ADMA ratio should do that for treatment reasons. But those who feel healthy and feel fit and still have a low arginine-ADMA ratio should do the arginine supplement for prophylaxis. And that is very important because the heart attack that people experience when they are in their mid-50s is the result of a process that already started 20 years earlier. So actually we have to start the prevention earlier than we feel the disease.
How much L-arginine should we take if L-arginine ratio is 100, 110 and so on?
The obvious answer is the lower the arginine-ADMA ratio is, the more L-arginine you have to take. Everybody should aim to get the arginine-ADMA ratio to 160 to 230, into that range. And when you are close to it, you need a small dose. When you're far from it, you need a higher dose. Normally, I recommend people to start with 2 spoons of Praginine and then repeat the ADMA test like after 2 weeks to see how high they have increased and whether they are at goal or not. And then from the difference in the arginine-ADMA ratio, I can recalculate what would be the optimal dose for that person.
Is the weight of the person critical of how much L-arginine we should take?
Yes, that is true. It makes a big difference whether there is a tall, maybe even overweight man or a small and lightweight woman who asks for the correct L-arginine dose. The bigger, the taller, the heavier a person is, the higher obviously the dose must be to maintain a high enough blood level. But an individual recommendation can trustfully only be done when we do the ADMA test and know what the arginine-ADMA ratio in that individual is, and then recheck it after a few weeks of taking a supplement.
Okay. How dangerous is it? High cholesterol if L-arginine ADMA ratio is 100, and how dangerous it is when the ratio is over 160?
Cholesterol is one of the primary risk factors for atherosclerosis. So high cholesterol is always dangerous and should be treated when it is above certain limits. There are clear recommendations by cardiology societies what to do and what drug to take. The component of the cholesterol that is really dangerous for the arteries is the so-called oxidized LDL cholesterol. People with a high arginine-ADMA ratio have less oxidation processes going on in their arteries. Therefore, people with high cholesterol should have a clear reason to keep their arginine-ADMA ratio as high as possible. And if they do so, the risk that the cholesterol brings about is lower than before. But still, I would recommend to get the cholesterol level treated. And this treatment normally is being done by cholesterol-lowering drugs that are called statins. We have done clinical studies that clearly show that the combination of this type of drug, the statins, plus L-arginine, works much better than the statin alone. So people who are on this type of drug, I recommend to also get on arginine plus citrulline supplement in order to do the very best they can for their blood vessels.
Is ADMA value equal to all people in the first place?
When we do measurements in large populations, and we have, for example, analyzed the huge cohort that is called the Framingham study from the US, with more than 3,200 people in the study, we see quite a variability of ADMA in these people. The levels range between 0.3 and 1.5 micromoles per liter. When we then select the very healthy young individuals, we see that the normal range that a person should have is between 0.3 and 0.7 micromole per liter. Everything above 0.7 micromole per liter is associated with a higher risk of heart attack and death.
Okay. Is ADMA value genetic?
Yes, there is a genetic component to ADMA value. The proportion of ADMA that is determined by genes is about 20 to 30%. At the same time, that means that all the rest, 70 to 80% of the ADMA level, is influenced by disease and by lifestyle. So we can do a lot about our ADMA.
Okay. Will the risk of atherosclerosis and heart attack be less if L-arginine ADMA ratio rise?
That is a very good question, and I can refer again to the Framingham study that I have cited before. In that study we can show that a high arginine ADMA ratio is associated with a lower risk of mortality than a low arginine ADMA ratio. And from that study we also get the ranges that we want to get people in, because here we show that ranges below 100 are associated with a higher risk. So we want everybody higher than 160 into the optimal range.
People with insulin resistance develop type 2 diabetes. They often have low L-arginine ADMA ratio. What can you tell about that?
Yes, it is well known that people with type 2 diabetes have low arginine ADMA ratio. Most of the time that is due to high ADMA levels. Diabetes is one factor that can increase ADMA. At the same time, many of these people have low arginine levels because of the way they eat. And diet is also a strong influencing factor for arginine levels. The problem that people with type 2 diabetes have is that this disease goes along with a high risk of cardiovascular complications. So again, everybody with type 2 diabetes is among the group that I would strongly recommend to use arginine supplements in order to get the arginine ADMA ratio into the normal range, into the optimal range, 160 or higher.
Will that be the same on type 1 diabetes?
With type 1 diabetes it is different, because people with type 1 diabetes are normally at younger age, and type 1 diabetes is not so often associated with other risk factors for heart attack, like overweight, like lack of sports activity, like smoking, like high blood pressure. So people with type 2 diabetes have a far higher risk than people with type 1 diabetes.
There are various types of L-arginine. Is it the same effect on all types of L-arginine supplementation?
Ja, es gibt in der Tat auf dem Markt eine unübersehbare Vielzahl von Arginin-Supplementen. Grundsätzlich muss man sagen, Arginin, egal aus welcher Quelle, führt zur Steigerung der NO-Bildung. Das Problem ist, dass Arginin aus dem Blut sehr schnell wieder verschwindet. Und wenn man ein herkömmliches Arginin-Supplement einnimmt, zum Beispiel zweimal am Tag, morgens und abends, dann gibt es große Bereiche des Tages, während derer dieses Arginin gar nicht im Blut vorhanden ist, weil es so schnell aus dem Blut wieder ausgeschieden wird. Daher ist zu empfehlen, die Kombination aus Arginin und Citrullin einzunehmen. Denn unsere Studien zeigen eindeutig, dass ein solches Kombinationspräparat aus Arginin und Citrullin dazu führt, dass der Argininspiegel über viele, viele Stunden erhöht bleibt. Und wenn ein solches Präparat zweimal am Tag, morgens und abends, eingenommen wird, kann man während eines gesamten 24-Stunden-Zeitraums einen höheren Argininspiegel als vor Beginn dieser Einnahme erreichen. Das zeigen eindeutig die kontrollierten Studien, in denen dies untersucht wurde.
So in the end, do you use this supplement with L-arginine?
Yeah, that is a good question. I do use arginine plus citrulline supplement on myself, and I have been doing so for years now. If you ask me why, I must say I feel healthy, I do sports, I try to eat healthy, and I have no symptoms. But I know that my ADMA is higher than 0.7, so my arginine ADMA ratio, when I measured it first, was not in the optimal range. And I titrated my supplement so that I am in the optimal range now, and I can say I do what I can to reduce the risk of heart attack and death in myself.
Nu är jag inne på laboratoriet Bøger. Eller flera laboratorier, men det här är på de tar de test, atma-test. Mr. Bøger, we are in another type of laboratory. You can tell about this laboratory.
This is the laboratory equipment that we use when we do the ADMA measurement in plasma. This equipment that you see here is worth more than €500,000, and we need that for the ADMA and arginine measurements in blood. So that is why this ADMA test is not easily done in every laboratory around the globe.
Okay, thank you.